Hi, Dr. Barrett here. In this video, I'm going to show you how to quickly stop gallbladder pain. I will show you 4 things you can do to heal your gallbladder. By the end of this video, you will understand the purpose of your gallbladder, why gallbladder problems can occur, and what you can do to heal your gallbladder. My purpose is to help people live better naturally. As a chiropractic, nutritionist, and herbalist, I've helped tens of thousands of people, and I want to help you too. I've created a free quick reference guide to go with this video. It includes the details of the natural remedies I mentioned here, plus acupressure points that can make them even more effective. Click the link below to get your free copy today. Okay, so you're having gallbladder pain. Here's what you do. Get some turmeric, some black pepper, and heat 8 ounces of water, but don't bring it to a boil. Stir in 2 tablespoons of turmeric, along with some ground pepper. Then drink. That's all. You might feel some things happening in the gallbladder area, and you'll likely have a bowel movement, which should give you some relief. Relief is usually felt within 30 minutes, and for some people it might take a little bit longer. Several studies have shown that curcumin, the active ingredient in turmeric, has beneficial effects on the gallbladder and the liver, like reduced inflammation, increased gallbladder function. We use black pepper because it contains piperine. Piperine is a natural compound known to help promote curcumin absorption. I have included links below with studies about the beneficial effects of curcumin and piperine. Once your symptoms are more manageable, it's time to begin the healing process. To heal your gallbladder, it's useful to know a little bit about how it works. The gallbladder is a small, pear-shaped muscular sac nestled beneath the liver. The liver is behind your lower ribs on the right side. The liver creates bile, which is absolutely necessary for digesting fats and harvesting fat-soluble vitamins like vitamin A, D, E, and K. Fat-soluble vitamins are essential for immune system function, nervous system function, cardiovascular health, and bone health. Bile is formed by the liver in small amounts throughout the day. But bile is only needed when you consume fatty food, and then it's needed in quantity. So your body has a wonderful system for handling this. Bile exits the liver through a tube called the common bile duct. Bile is then diverted into the cystic duct, where it travels to the gallbladder for storage. When you consume fat, the body releases a hormone that signals the gallbladder to begin contractions. The gallbladder rhythmically contracts, sending bile back through the cystic duct and into the common bile duct. Bile then travels down the common bile duct and into the small intestine, where it helps to break down fats. The pancreas usually shares a common drain into the small intestine via the pancreatic duct. Gallbladder function can be affected by poor diet, drugs, alcohol, pregnancy, obesity, and rapid weight loss. Gallbladder function can also be reduced if you're not consuming enough good fats or you're consuming too many trans fats. A healthy gallbladder keeps bile flowing smoothly. However, when gallbladder function is reduced, bile flow slows and bile can become thick and sludgy. Stagnant bile can crystallize and form stones. If there is sludge, crystals, or stones, pain can occur when the gallbladder contracts. Rhythmic contractions can cause severe pain, mild aching, and everything in between. Over 25 million Americans have gallstones, and there are about 1 million new cases each year. Women are particularly vulnerable, accounting for more than 75% of the cases. Severe symptoms are felt as a sharp, severe stabbing pain, often located in the right upper quadrant. Attacks may last for 15 minutes to several hours. It may be separated in time by weeks, months, or even years. The pain often occurs after meals, particularly a high-fat meal. Pain may be felt between the shoulder blades. in the right shoulder, and sometimes in the chest, where it is often confused with a heart attack. Patients with severe symptoms should seek medical evaluation. Medical treatment tends to focus on diagnosis and pain relief. People with gallstones are frequently offered surgery, and those without pain are told they don't require treatment. Removal of the gallbladder is the most common elective surgery performed in the U.S., with over 750,000 operations performed annually. Removal of the gallbladder may relieve pain, and in some cases may be life-saving. But removal also leaves one with an impaired ability to digest fats and absorb fat-soluble vitamins. Studies show that 2 years after surgery, at least 40% of patients still have symptoms like nausea, pain, gas, bloating, diarrhea, and food intolerance. The holistic approach focuses on restoring function, which tends to relieve problems and prevent recurrences. About half of those with gallstones don't associate their symptoms with gallbladder problems. Obvious symptoms include abdominal pain, upset stomach, and nausea after eating fatty food. Less obvious symptoms can include dry skin, thinning hair, right shoulder pain, nightmares, craving sweets, and a tendency to worry. Here are 4 things that you can do to support your gallbladder. 1. Castor oil packs. Unrefined castor oil has a detoxifying and pain-relieving effect. To make a castor oil pack, you'll need a face cloth or a small hand towel, some cold processed castor oil, a bowl, and a hot water bottle or a microwavable heating pad, plus a plastic bag. Here are the steps. Heat your hot water bottle or heating pad. Place the cloth in your bowl, pour the castor oil over it, and work it in until the cloth is saturated with castor oil. Apply the cloth to the lower right side of your abdomen, cover with a plastic bag, then place the heating pad on top of that to get the heat. Rest for about 45 minutes. When you're finished, take off the pack and wipe any excess oil off your skin. If you want to reuse the castor oil pack, put it in a plastic bag and store in a cool place like the refrigerator. When you're ready to reuse it, just add another tablespoon of castor oil to the cloth. It will be good for about 10 uses. Keep in mind that castor oil stains fabric, so you might want to cover up whatever you're laying on and wear clothing you don't mind if it gets messy. 2. A 5-day flush. There are many gallbladder flushes around. I like this one because it's spread out over 5 days and is well tolerated by most of my patients. First thing on rising, drink 8 ounces of spring water to flush your digestive tract. About an hour later, blend 8 ounces of fresh squeezed citrus, apple, or grape juice with 1 lemon and 1 clove of garlic. Not a whole bulb, just 1 clove. And then add a tablespoon of olive oil and a piece of ginger about 1 inch long, plus 48 ounces of spring water. Surprisingly, most people find that this tastes pretty good. 15 minutes after consuming this drink, follow with 2 cups of dandelion tea. Repeat every morning for the next 4 days. Each day increase the garlic by 1 clove and the olive oil by 1 tablespoon. And that is the 5-day gallbladder flush. Here's the third one, peppermint tea. Peppermint contains menthol, a soothing compound. Traditionally, peppermint has been used to ease pain, improve digestion, and relieve nausea. If you're having gallbladder pain, drink the tea so your pain goes away. I suggest you drink peppermint tea regularly to reduce the frequency and severity of gallbladder symptoms. 4. Dietary changes. What you eat can have a huge impact on gallbladder health. I suggest you focus on monounsaturated fats, such as avocado and olive oil. Have lots of fresh vegetables. Choose lean meats and have moderate amounts of fresh fruit. Avoid highly processed food and avoid any foods that you know trigger your gallbladder pain. You should also consume fatty fish about twice a week, or take omega-3 fish oil supplements every day. In this video, I covered how to use turmeric to relieve gallbladder pain quickly. I explained how the gallbladder works and what can go wrong. I explain how to use castor oil packs, how to do a gallbladder flush, and the role of peppermint tea and diet choices to relieve symptoms. These are some of my favorite remedies. I know there are a lot of other good remedies out there. Please share any experiences you've had handling gallbladder, as your experiences may help others. If you like my videos, just click the subscribe button and the bell icon. And please forward this video to anyone you know who may be dealing with gallbladder issues. Thank you very much for tuning in. Till next time, this is Dr. Barrett signing off, yours for health naturally.